And we're starting sharp. It's 9 o'clock. And I would be, if I get a little teary, I'm unapologetic. We need to start by thinking of how we talk about and recognize what's gone on in Surfside. And as I was trying to think through it with my daughter, my 19-year-old daughter said, "Mommy, I think instead of giving credit and trying to name everything that's going on, I would just ask people to be kind. I think it's a good time for us to think about how we can most honor people by being kind to each other and showing up." So here's to everybody who is connected, because we're all connected. And today we are showing up, and I'm welcoming you on with our board members, our incredible, powerful board represented in this next slide. Too many of them to fit on one. So we thank you and the staff that you see here, Carolina and Viviana, who are moving this great machine, and Kami, our part-time intern, who's more than an intern, working with us so much, and the 5 amazing student interns who are with us. We thank you for breaking a sweat and all you do every day. We have many current and former board members on the Impact Collaborative today. Say hello to each other, please. Chat, share information. We also have great people who serve as the community. Judge Carol Kelly is going to be with us today, leading in the domestic violence courts. We thank her for her service. And Cindy Lerner is joining us today, who's filled all kinds of roles and never stops. So many community partners, direct service providers. Thank you for all you do. Our founder, Marilyn Gladstone, talked to me and sent her best to everybody. And she is making a little call of gratitude to you all. With the next slide, Viv, to thank all of you who can support us in our grand mission, because some people have been able to donate to help be on the Impact Collaborative today, and some people have a greater capacity. We need to fuel any machine, because as we move forward together, we're stronger. And to move forward, of course, we need fuel. So thank you for all of our donors and supporters. Your energy is vital. And we also want to give a heads up to those of you who are in the legal community, all the people associated. We have our big signature Raise the Bar, which is back in 2021 on October 7th, and it's pretty fun. So save the date. We've got a lot of attorneys on our board, so this is for you folks. Next, this Impact Collaborative is one of 12. We meet every month to talk about one of our 4 pillars, and that is empowered by the Scaola and Aiken family and 1 Billion Rising, who keep on focusing us on the solidarity and the strength of working together. So thank you all. Kaufman and Rawson is our pillar sponsor. Kaufman and Rawson and Janet Altman put their money where their mouth is. They really care about, Daddy, why do you pay women less? They care about equal pay and support campaigns, public awareness campaigns like these. And also I want to take a moment to talk about what economic mobility in each pillar is. Economic mobility is the reason we're talking about childcare. Whose business is it? But does it not incredibly influence our leadership pillar? Because how is a woman going to be able to take on the roles of leadership, which she would be great at if she has that added worry and care and responsibility of early childhood learning and care, which we call childcare. And the same thing, health and well-being pillar, because our well-being and our mental well-being especially is completely dependent on, are the kids all right? So thank you, Kaufman and Rawson, for your support of economic mobility and all that we do. So complex issues, big issues that influence us greatly in our daily lives often get pushed to the bottom because they appear to be too large to tackle. Although childcare is one of the most important things affecting our community, we don't think we can deal, but we can, because when we come together with experts who are so capable of comprehending these major issues, They know it well enough to make it seemingly simple and explain it to us. And to that, we thank Michelle Watson from the bottom of our intellectual hearts for doing our keynote and talking about the big picture for us. Welcome, Michelle.
Thank you so much for having me this morning. I'm really excited to join this dynamic group. And thank you for really posing the question, whose business is it? You know, for a long time, we've all known that childcare is really, really important to the development of children's foundational skills, right? Either their hard skills, learning their letters and numbers, or even their executive functioning skills, time management, how to get along with others, and social emotional learning. And we knew and we know that it is really, really important, especially within the first 5 years as children develop, that experience sets the tone for their lifelong learning. And so with that, we've had great opportunities in Florida to really educate policymakers, decision makers on the importance of early learning. Secondarily to the fact that we know it's a huge economic support. And I think what we've seen over the last year is COVID kind of turned it back on its head, where everybody understands finally, yes, this is great for child development. This is wonderful for children's foundational learning and their future success. But without childcare, very clearly we saw on a large impactful scale that when childcare was closed, what it did to not only employees, but employers. Whether it be that even if you were able to work from home, not having adequate childcare really reduced efficiencies to a level that negatively impacted women mostly because they were the lead caregivers at home, having to do homeschool with their children, as well as having to work. And we know that productivity went down across the nation for a lot. The other part of this is that this is also a business sector where a lot of women are employed, and women in minority categories are employed and have taken this on as a profession. And they lost not only their ability to earn wages, which would move them out of the childcare system, but also a lot of mental health struggles with the fact that they were dealing with very young children who didn't understand, you know, how to appropriately meet the sanitization and group size requirements. You know, when you're asking a 3-year-old to wear a mask, that is really, really difficult. And you have this singular person who's responsible for the health and safety. And it's a lot of stress, right? It's a lot of stress on a workforce that was already feeling a lot of stress in the fact that it's really difficult to get childcare instructors. It was typically a low wage industry. I can tell you now that looking at cost modeling and looking at hearing from providers who are having a really difficult time finding a workforce, whether it be because they had to furlough staff when their centers had to close and that workforce didn't come back, or that they lost staff just due to fatigue of the situation. We are now having in the childcare industry, and we have experts on this panel that can go deeper, a true child care conundrum. In the fact that we are trying to figure out how do we get the workforce back into childcare so that we can get childcare availability back to the general population workforce to be able to move forward as we open back up as a nation and as a state. And those are really things that are keeping a lot of experts who have been working in this field up at night, and you will hear from them today. But you know, one of the things that we were braced for potentially was the minimum wage increase within the early childhood sector being a really positive thing, while hopefully having that stepped implementation time for parents to be able to understand that through the referendum that their childcare costs would potentially go up over time, right? We would see it as a $1 a year kind of increase, and then this mutual increase of childcare. And because of the supply and demand of the workforce, I think we're going to see that cost burden being passed on to parents much more expeditiously than we ever thought, because of the lack of availability of workforce right now. And so there are centers out there who are today trying to hire at $15 an hour versus having that 5-year span to increase up to $15 an hour, because they need those instructors in the classroom to open up classrooms so that families and parents can work. And so really, when you're thinking about how your reopening plans are moving, if you are a business, and how you're supporting your workers, one of the things that you need to do as a business is understand your employees' circumstances. How many of your employees have young children? Is there adequate space for them to be able to attend a childcare center? And if there's not, because there are waiting lists all over the state of Florida, what is the interim plan, right, to bring that employee back so that it's not seen as a opportunity to not have that employee? Because we know that onboarding new employees and training up to job skills is really expensive. You would rather keep a really good employee and work with them, but it really is going to be on such a case-by-case basis over the next many months about when employees can return due to childcare, if that's an issue. And we know that from an HR standpoint, that's always not a great place to be in, right? That you're making concessions for one sect of your employee population and not another. But it really is going to be the time where within businesses, HR is really going to have to look at what is the cost benefit analysis between moving towards a stepped return versus a whole mandated return, and potential loss of really strong employees. And so really that is the big picture overview. Whose business in it is it? It's everybody's. And I think what's happened is that COVID has really shined a light on essential workers in general across the nation, right? People and employees that we wouldn't have ever thought of as being so essential, we've now highlighted and lifted up as being, you know, the helpers, right? The grocery store stockers and clerks, the nurses, the janitors at the hospitals, childcare instructors, everything that we knew was part of our day-to-day infrastructure has now been highlighted as the fact that these are really essential workers. And how do we think through, how do we work with those essential workers moving forward? Because we know that without them, that the fabric of being able to move forward becomes either a really thoughtful path forward, or can bring us down in the opportunity to get to true efficiency and back to normalcy, as much as we can feel that, because of supply chain issues, right? I hate to talk about childcare as a supply chain issue, but it really is a supply chain issue at this moment. When you don't have staff, childcare is going to go up as much as lumber. And I hate to make that comparison, but we know that if anybody is building or doing home improvement right now, that lumber's gone up 300%. And we're about to see the same thing in childcare. And it's really more high stakes because it is the foundational development moving forward. So I just want to take the time and opportunity, one, to say thank you for having this conversation, and two, this is solvable, but it's going to take everybody. I always say that the early learning system is everybody's and it's nobody's as far as ownership is concerned. So we all need to play our part. We all need to continue these conversations and really think about solutions, and solutions that are not necessarily one size fits all. We're going to have to be really nimble in this rebuilding time to be able to come out on the other side with a really strong childcare infrastructure.
Not plywood, right?
Correct.
Mahogany. If we're going to talk with the lumber analogy, let's value the people who are building for us in this industry as they should be honored. Thank you so much, Michelle. We're going to ask you to join when we come at the end to the Q&A. And that leads me to, remember folks, this is how it goes. Welcome to those of you who it's your first time. We beg you to feel alive and engaged and to know that this is your Women's Fund and this is your impact collaborative. Walk around like you know the place, like you own the joint, because you do. Use the chat, share your connections, share your questions, and share any resources that you have and suggestions. Please, in the chat, post your questions in the Q&A. Answer the polls as we go. They're simple, they're not overly distracting, and one of them later will give you the opportunity to put your indication in if you would like to have further connection with any of our panelists today. Every Impact Collaborative, we add more threads to the fabric of our community by putting people together. So very well may be that somebody wants to speak with Juanita afterwards, and Juanita said, okay, you can give them my email. So that opportunity will come up in the poll, and Carolina will put you in touch with the panelist or the panelists or the organizations of your choice. So now we are going to go ahead and ask each of our co-chairs who are here in the audience today to also say hello. Debbie Bussell, I think I saw you there before. Michelle, I think is about to show up. These are the co-chairs of the grant making committee. And why am I bringing this up? The Women's Fund has not only the powerful board that you saw before, but we have several committees. 3 of them accept non-board members to them. And one of them is our grant making committee. We also have the advocacy committee and the research committee. And we have some of the chairs who are with us here today. They have brilliant volunteer participants from the community. But today we want to focus on the grant making committee. Why? Because the grant making committee is studying very deeply this issue of childcare, and the experts here today are helping us get to the bottom of it. The board of directors and the executive committee have been seeing childcare as a core issue here in Miami and nationally. The Women's Funding Network and many of the affiliates are finding the same thing. So the grant making committee is here listening hard, and we thank you all. Right there, there are your names. Zafreen, I see you're here today. I know Sandra is joining us. Leslie, thank you all for being here today. So onward, we are going to ask each of our panelists to, in less than 2 minutes, introduce themselves. Why so short? Because it's in context of today's topic, childcare. Whose business is it? Rachel Spector, welcome and thank you for all you've done.
Okay, thank you so much, Mara. Good morning, everyone. Thank you for inviting me. So glad to be participating in this conversation. I'm proud to serve as an Associate Director of Programs at the Children's Trust. We have an amazing board of directors led by Ken Hoffman. And I feel grateful that our board really believes and understands the importance of high quality early learning and early child brain development. So they have continued to support our efforts. We invest a little over $20 million a year in working on quality initiatives to increase the quality of our early learning programs and also increase access. One of our goals is to make sure that all children in our community have equitable access to high quality early learning programs, regardless of their zip code. We want to be sure that all children in our community are ready when they go to kindergarten, of course. But as we're talking about today, we also want to impact the workforce supply. We want to support our early learning workforce, and we want to also impact economic mobility for families. So all of these things, as Michelle mentioned, are tied into early learning. And I'm, early learning and early childhood is my passion, and I get to work alongside these amazing, my co-panelists and many other community partners to address this issue in our community. So thank you for having me.
One thing that's abundantly clear in all of this research that we've been doing is Miami-Dade County is particularly advantaged and, may I say, blessed because of the work of the Children's Trust and the ELC and others. So we thank you, and Rachel is going to help us land and make bring things local, as will Evelio. But I'm going to let poster child, model leader in this business, Juanita Walker. Thank you for being here.
I tell you, I'm a poster child. I'm loving that. I think that's Robin's plan right there. So I appreciate you all. I'm Juanita Walker, for those of you who don't know me, and I really appreciate you all having me on to tell about our plight as owners, as business owners, and what we've been doing. I'm the owner of Shades of Miami Learning Center. My centers are located in the Liberty City area. We have 3 locations between Liberty City and the Brownsville area. I'm stuttering. We actually take care of children between the ages of 6 weeks to 5 years old. And then the last 4 to 5 years, we've started an elementary school. I currently employ about 45 people, mostly women. So, it's been very, very good. I worked the area for many years as a City of Miami police officer, retired as a police major. And I found it to be very rewarding to just work in the area, as I've done for over 30 some odd years. And the reason why I went into this business is because I saw the need. Our kids, our children out there and mothers needed the help. I actually employ many homeless women. I saw where we needed to educate not only our children, but to educate our parents and to get them involved. I am currently working now, and we're all of our schools are accredited. We're currently now reaccrediting one with Apple. So we work very hard for our community. We want to pay it forward. We want to make sure that our children get the proper education and exposure that's needed. We work in an area that's low income, but the children deserve it. Our children are out there. The parents are busy. We worked actually through the entire pandemic. We were open because we are considered to be essential employees. And we worked so hard now to change the way people actually look at us as child care workers. We've changed our image. We're trying to make sure that people know that we're educators. We're not a babysitting service. We don't babysit. So we're there. We're here to serve, and we're here to serve our community and to do what we need to do to make sure that our kids get the best education possible. I've had so many great supporters, such as Evelio. I can call on him at any time for anything. I've got Robin Perlman, who's on the board, who's been a real mentor for me, because although I college degreed and all of that good stuff, you learn every single solid day. But to change the way that people look at us as childcare owners is so important, because we're about educating. We're about providing jobs. As I told you before, we were open through the entire pandemic. These are our youngest learners, and we're trying to do everything that we can now to support our parents or people that are working. We've served the essential employees. We've served first responders, and we're here. We're in the community, and we're doing what we need to do to make sure that we properly educate our children and provide the very best service that we could. In our community, not only are we low income, we're dealing on a day-to-day basis with children with mental health problems, with trauma. Some of our kids have even been to the point of, this is my passion because I worked it for so long, that our children face trauma on a day-to-day basis. And we're trying to do what we can to provide the help. I hire, like I said before, 45 people. I employ 45. And I try to hire women that are like-minded, that genuinely care, that genuinely want to be in the community to help out with what's going on there. Um, I'm loving what I'm doing. We're trying to make an impact. We're trying to change the way people see us. And we want to make a difference in the community. We're not babysitters, we're educators. And that's the way I would want everyone to look at us. We are trying, like she said earlier, the young lady that spoke earlier, he said that, you know, we don't make the funds. We're not getting the type of monies that we truly, truly deserve. And we're working on that. I speak to Evelio almost daily and others, writing to them because the young ladies and men that I employ, they deserve better. Our children deserve it. So
Well, we're going to ask you, Juanita, to help with some of those challenges and solutions in this next part. You have a huge fan club.
yeah,
Everybody who's on camera here, and I think you already started helping Robin to introduce herself. So Robin, we'll ask you in just the 2 minutes just to give a very brief intro, and then we'll come back to everybody and we'll talk about those issues that you're all seeing and then the solutions. We'll do the round robin. So
thank you
Robin,
so much.
look up your intro. Thank you.
Thank you.
Good morning, everybody. I'm Robin Perlman. I'm the president and founder of the Business Leadership Institute for Early Learning. Simply, we are a CEO school for owners and operators in the field of childcare, seeing these individuals as social entrepreneurs. Why social? Because they must operate with profits, and the profits are reinvested in their mission. And as we know, as business women, profits are the oxygen of a business. And for many, many years, especially in low to moderate income communities, profits were looked at as something that you should not equate to childcare. Does that say who we are?
That's perfection. That is absolute perfection. And we'll be back to you soon, but we're going to welcome Evelio and ask him to introduce himself.
Good morning, everyone. Very happy to be here with all of you this morning. Yeah, I do have a couple of slides that I just want to go over as I do the introduction. I'm the president and CEO of the Early Learning Coalition. We collectively across the state manage about $1.3 million. Actually, it's much more now due to some of the COVID relief federal dollars through 30 early learning coalitions, and we serve all 67 counties. The Early Learning Coalition of Miami-Dade, Monroe, of course, serves our 2 counties here in South Florida. We are not-for-profits established as part of the 1999 School Readiness Act, currently serving around 45,000 children in a number of programs. We have a subsidized school readiness program for low-income working families. We also have the state's voluntary pre-kindergarten program, which, as everyone knows, is embedded in our state constitution for all 4 and 5-year-olds. Our budget is about this includes some of the COVID dollars, but as of yesterday, is about $267 million. So we are and remain one of the largest not-for-profits in Florida. We are quasi-government, so we're not your typical not-for-profit because we are an instrumentality of the state, because we are in statute and created by the state legislature. The next slide is a map, just to give you an idea of where some coalitions are single county coalitions like Palm Beach, Broward, Hillsborough, Pinellas, and some are multi-county like Miami-Dade and Monroe, and some of the ones up in the Panhandle. But we serve all 67 Florida counties. We can go to the next slide. Our focus is kindergarten readiness and making sure that we close the achievement gap with a special focus on children 0 to 5. You know, those first few years are critical, starting from infancy. Focused equity and inclusion. We have an equity institute, so we do a lot of community work on equity and making sure that our communities are fair to everyone and that everyone has an equal opportunity to succeed, both children and their parents. And we're not a political organization, but we do try to have these meaningful discussions with the community. The one that we have coming up now has to do with statutes and monuments. Why have they become such a lightning rod, right? Why are they so offensive? And it's just a community conversation like we're having here today, trying to learn and grow together and trying to see what changes we can make to improve living conditions for our families. Improving public policy, which is one of my passions. I love public policy. I love being involved in that process. And we do a lot of work with Michelle and others on this panel to try to improve public policy for children and families in our state. Workforce and Economic Development, our largest program, which is our Subsidized School Readiness Program, provides a childcare subsidy to working families so that they can either get back into the workforce now, which is so important, or remain employed, because as you know, the cost of childcare is very expensive and getting more expensive by the day, particularly with the minimum wage increase. And promoting healthy communities through innovative programs and partnerships like the ones we have with the Children's Trust is a good example of, or with the Business Leadership Institute. We couldn't do it alone. We work very closely with our community partners just to try to improve conditions for everyone. So that is the intro of the Early Learning Coalition.
And we thank you. And we are going to ask you now, Rachel, to kick us off with Make This Real for Us. These are people gathered here who care. We see federal funds coming down. We're trying to rebuild better. What are the big challenges that you're seeing in the Children's Trust here in Miami-Dade?
Okay. So, I mean, this is basically a lot of what Michelle alluded to at the state level, right? And the big issues. And these are some of the issues from my perspective that we're seeing in Miami-Dade County, not necessarily, actually not as a result of COVID, right? These issues have existed long time. They're highlighted now, as Michelle mentioned, and that's why I think it's so amazing that we're having this conversation, because now is our moment, right? We have a lot of attention. We have a president and administration that's focused on this issue. So while these are not new issues, I just want to sort of talk a little bit about what some of them are. So in contrast to other places in our state, Miami actually has an oversaturation of our childcare market, especially in low to moderate income communities. There are too many childcare programs for the amount of children to be served. And unfortunately, all of them are not of high quality. So the issue is that that Michelle alluded to is that it just causes incredible financial issues when you're basically in competition with your neighboring small businesses, and they are driving down some of the driving down the cost. Now with the minimum wage increase, we're going to see small businesses are going to have to start paying more. But in the past, we've seen like teachers will jump right from center to center looking for a little bit more money, or parents will go from center for center looking for costs, lower costs. The consumers are not really the one that is driving this market. So in terms of parental choice, the research is showing us that parents are choosing their childcare based on cost and location. They're not necessarily, there hasn't been a lot of public awareness and a lot of education. We've tried over the years, but I don't think we've been as successful in helping parents understand the importance of high quality early learning, of the importance of early brain development. And so those are sort of, how parents are making their choices. In addition, Ms. Juanita mentioned that they need funding, right? They need quality, they need supports, they need financial incentives to be able to pay their teachers a fair living wage, to be able to keep their facilities, up, looking good and without repairs. They need to buy curriculum. They're dealing with a lot of different children, and families have different needs. Maybe it's serving tea or coffee as parents are coming into your program to make them feel welcome, stuff like that. It all costs money. So there isn't a lot of support. There hasn't been as much support for really offering financial incentives instead of just stuff, materials and coaching and stuff like that. The other issue, which I'm just going to touch on because it's Avilio's expertise, I'm sure he's going to talk about it. But in low to moderate income neighborhoods, the majority of children they serve have receive a federal child care subsidy. They also serve, of course, families that are paying privately, but those families are basically able to pay the same amount or maybe slightly more. And the reimbursement rate in the state of Florida for subsidized childcare is extremely low. It doesn't come anywhere near the cost of what it costs to take care of a child. I know Miss Juanita will tell you that over and over, that she doesn't receive enough to adequately take care of a child. And then there's other complications related to that for Miami-Dade in particular. So the readiness rate is very, very low. It's difficult for owners to even come close to the cost of care, and then that eventually is going to get passed on to the parents. And then, as Michelle mentioned in the beginning, I think we all expected the minimum wage law. It's a good thing, right? Like, we want everyone to earn, not that $15 an hour is a livable wage, but it's certainly getting closer than $10 an hour. But I would agree with Michelle's assessment that at this point today, people like Ms. Juanita and other owners are going to need to start paying $13, $14, $15 an hour just to keep their teachers, just to keep teachers and get teachers to walk in the door. We have a shortage, right? It's in my opinion, easier to go work at Target or Chipotle or somewhere for $15 an hour than have one of the most important jobs in the world, educating young minds and building children's brain, right? So that's sort of what we're up against right now here in Miami-Dade County.
Juanita, a leader doing one of the most important jobs in the world. Thank you. Please tell us what the challenges you see. About 3 minutes for this segment. Lead on, Juanita, please.
Okay, I'll make it short and sweet, but she's right. That's one of our biggest problems, challenges now, would be just getting staff, especially in the areas in which I work, in the Liberty City and the Brownsville area, because people simply don't want to come. They can go, like she said, work at Targets, work at Burger King and get more money. The minimum wage is going up now to $15 an hour. Now, we are, and I think Evelio would go over it even more with you, we're not getting paid the money that we truly deserve as young early learning educators. For an instance, Palm Beach, for an infant, they would receive $60 a day. We're receiving $48 a day. We just got that. And then for a toddler, Palm Beach, other areas are receiving $44 a day. We're receiving $29 a day. So how do we hold our staff, get them in and to even encourage others to want to come into our field is very, very hard, because they can go other places and get and earn more money. $15 an hour, we're working our way, we're trying to work our way up as much as we possibly can, but the money is just not there. Other challenges are that we're doing a reconciliation with our ELCs and when it's just no way, it's very hard for us as owners to reconcile on a month-to-month basis. The monies that we're receiving, you may receive $2 more last month and then more this month. And it's very hard for us to reconcile. And then for us to be at this particular point, ELC or any of the others taking money back from us during the summer. We're in the summer now. In the summer, we're lower than we are at any given time. So it's been very, very hard. We've asked and requested to be paid according to the children that we have registered, not according to the children that actually come. Because right, the way that it is going now, if the children don't come, we don't get paid. And during the summer, we're already short. And how in the world are we supposed to pay others or pay our staff with that? But it's very, very difficult, because we just cannot afford to do what we've been doing now. And we got to get to the right people to let them know that this is not working. It's not working for us. We know our worth. We've worked it. We're dealing with a group of, we're dealing with the community, and we're having here, we should actually get more. We have the shootings. I have one kid that was shot. His sister was killed during the time, and he comes back, he's crying. That requires a little bit more help. And we have trauma. We have so much going on in the neighborhood. We deserve it. We've, all of our schools, especially SAYS, we're accredited, we're reaccrediting one. We're providing the same service that others are providing and more. But it's been very hard to get staff to even come into our area to work for the amount of money that we're being paid. So I hope that others are really listening, because as I stated earlier, we're not babysitters. We're following our curriculum. We get great curriculums. We're even starting now adding more curriculums with the doc curriculum with Julia and her group, where we have the creative curriculum. So, you know, we're doing what we're supposed to do. We're educating ourselves, and we're trying to keep ourselves above water. But financially, this has been a real hardship for all of us. Okay, I know it's 2 minutes. So
people need to hear you, Juanita. So I'm going to repeat what I said before. These impact collaboratives are being recorded, and they're going to be available not only on the Women's Fund website, but also on YouTube. And please, anybody who can take Juanita's challenges there, the numbers, the expertise, and the reality, the human reality of what they're working with and dealing with in benefit of our entire community, that needs to be heard. So everybody who can share Juanita's challenges and later on ideas of solutions, we welcome you to do so. Robin, can you tell us about challenges and give us some business perspective?
So I want to reframe Juanita's conversation in a way I think it'll be easy to digest. Juanita is talking about stabilizing her cash flow and being able to forecast. In the public schools, they get federal dollars based on the enrollment, which is calculated maybe once a year, maybe twice a year. In childcare, submissions of your attendance every month must go to the coalitions. Now, from a business perspective, this is very expensive, requires a lot of accounting acumen, requires adjustments when things are not exactly correct. So this prohibits these small businesses that are operating on very tight margins from forecasting a way forward. Secondly, let's talk about the $15 an hour. Realize that's entry level now. That means every person that made 8, 9, 10, 11, 12 now is entering that small business at $15. That means everyone that was making 10, 11, 12, 13 has to move up the feeding chain. So as we work with owners, this is not a $15 minimum wage challenge. That's entry level. This is a $20 to $25 wage challenge. The other item is that when we readjust for $15 as minimum wage, this is going to change the poverty index. So families that have their children now in subsidy, when they move up to $15, may be thrown out of subsidies. One of the very difficult challenges that women have in the workforce now is they hit a financial cliff in their career. They hit $40,000. They may be receiving federal subsidies to help with childcare. Now they're given an opportunity for advancement, $5,000, $10,000. Now they have to calculate, wait a minute, is that worth it? So at that point in time, they have to make a big determination. Do I continue on a professional path and accelerate my credentials and my ability to monetize professionally, or do I stay in the system? The third conversation about talent, I am very optimistic. So in Dade County, I want everybody to understand if there are 3,000 students in the child care, career, and technical program in the high schools. There are in Hialeah Gardens, 500 girls in the child care program. 60 will graduate next year. At the Business Institute, we are looking at what would occur if we got into those high schools and started to mentor those young women on a career path in which they can monetize their passion through credentials, education, and entrepreneurship. Because you can create and monetize your passion in this industry if you know how to do it. And I believe that we need to look at the next generation. They're entrepreneurial, they're smart, and if we get in at the ground level, we can change the map and we can forecast a different future for childcare.
So good to hear. Evelio, the challenges, and then we're going to come back around and do the round robin on solutions.
So I sent the slide. Can we bring up the slide? Right. So this helps to illustrate the important point that everyone has made already. The source of this data, this is not local data, but it's Census Bureau data. Something we already know, 92.4% of the workforce in early learning, they're females. And if you look at the median hourly rate, $11.65, which is a long, long way from $15 an hour, right? So we have some work to do in this area. When you look at this data, which is national data, 15.7% are white, non-Hispanic. If we can go to the next slide. This is a little bit dated, but it's still very, I think, very much in line with the situation locally here in Miami-Dade, and it applies also to Monroe County. 69% are Spanish speakers, and when I say Spanish speakers, they struggle speaking in a lot of areas the English language. So we try to support them through professional development, and but understanding that this is the real situation we're dealing with. Our workforce is a little bit older, also middle age, 46 years of age. If we can go to the next slide. And this is something that my daughter, reminds me of all the time. She's in the workforce. The gap between women and men. We're doing a little bit better here in Florida, but we still have a long way to go. Women are generally making less. And we have to remember that early learning is also a low wage, low growth industry. So when you talk to chambers, although we're very fortunate that our Greater Miami Chamber, the Florida Chamber, they're very involved in this issue, particularly the Florida Chamber, and they understand the importance of supporting the early learning workforce, because their members, chamber members, all have employees, and they want all of those employees to come to work. And everyone is struggling right now, which has even highlighted this issue even more. Everyone is struggling right now trying to find staff, not only our childcare programs, but businesses in general. And we've heard that, and we hear that over and over again. So we, an important area to focus on. We have to really work on closing that wage gap that we still have, even in a low wage, low growth industry like childcare. This is a recent report from the Center for the Study for Childcare Employment. I'm not going to go over this narrative. I'm going to go over the next slide. This is for a single adult with no children, and this is looking at a living wage. And if you look at my not very neat highlighting there in the middle of the graph, that is Florida. So when we look at our living wage here in Florida, there are only 10 states across the nation, by the way, that are paying at least a living wage. But when you look at Florida, we still have a ways to go. And this is not even looking at $15, right? We still have a ways to go. This is for Florida. When you look at Miami-Dade, these same numbers for Miami-Dade, they're even worse, right? So we are looking at an area in South Florida, and not only Miami-Dade and Monroe counties where the cost of living is so expensive, but also looking at Broward and Palm Beach, even if, Pinellas and Hillsborough County, Orange County, it's expensive to live in these areas. And our childcare workforce are just not able to sustain their families with the very low wages that we pay. And this is like a domino effect here, right? One thing impacts the other. For programs that are in very low income areas, like Juanita Walker, for instance, they struggle because the reimbursement rates, and I'll talk a little bit about, more about that later, but you already heard about the reimbursement rates, and reimbursement rates are driven by market rates, right? Whatever childcare programs are able to charge in that market to a private pay parent. And that is, even if our reimbursement rates are higher in Miami-Dade County, we cannot reimburse more than that private pay rate. And I'll talk about that issue as a policy issue that we need to try to change. And it's a little bit bureaucratic and a lot complicated, but it's something that needs to be addressed in Florida. And, you know, like I said the other day when we were having a conversation, this is not rocket science. It is bureaucratically complicated, but it's not rocket science. It's something, it's an easy policy change that we can make in Florida. God knows that now we have several $1 billion in federal dollars, specifically for childcare in federal COVID dollars that we can try to use to help to resolve some of these issues that we have in this area. We can move to the next slide. And everyone, I think, has seen this slide over and over again, and we're addressing the equality versus equity and making sure that we give all children an equal opportunity to succeed. Well, we have to talk about the teachers, and we have to talk about our early childhood programs, not only the center-based, but also the family childcare homes. They play a very, very important role in childcare because many childcare centers may not provide infant care. Well, family childcare homes provide infant care. So families are able to go to work when they have a place to leave their infants. So it's something that again, we have to work on, and not only as we try to address the bigger policy issues with minimum wage and how we get there, but also how we support the teachers. And I have a couple of suggestions that I'll go over later, but it's something that is totally doable. I don't want anyone to think that this is so complicated that it's going to take us 5 years to resolve. I think we have some momentum now. We had HB 419, House Bill 419 that just passed in the legislature. It's an important bill for early learning in Florida. It's many important policies are going to come out of that bill. Improvements, but quality costs money, right? So if we want to support quality programs in Florida, we're gonna have to pay for those. You know, it's impossible to ask programs like the ones that Juanita Walker runs to stretch their dollars anymore. They're having trouble right now, as you heard, recruiting and retaining teachers. And one estimate, and this is the last thing I'll say, one estimate from an estimate that we got from one of our programs is that it's going to cost them, between bringing their staff up to the minimum wage and increasing other salaries for their current staff, is going to cost them about $200,000 a year. That is one of the current estimates. And those are real dollars. These are real small family owned and operated businesses for the most part. And, you know, they, like every other business, they have to try to figure out how to make ends meet. And it's getting more and more difficult. But you know, I look at the glass half full, and there are ways to resolve this issue, but we need the political will to be able to do that. And we need, you know, strong advocacy efforts. The other, and I promise this is the last thing I'll say, you know, we can't be all scattered all over the place, which is a tendency in our space, right? We want to solve every problem in the world and we want to solve it tomorrow. Well, you know, everything gets lost in the shuffle there. So let's pick 2 or 3 important policy priorities. Let's focus on those priorities and let's get those, you know, let's take those to the finish line within the next, you know, 2 to 3 years. But when we talk about 10 or 15 priorities, then we don't get anything done. So that would be my very, very strong recommendation in terms of policy. Let's not be scattered. Let's pick 2 or 3 that we think we're going to be able to take across the finish line.
And your Women's Fund is listening. Thank you, Evelio. Note taken. I know there are a lot of note takers in our plaza here with us today, paying close attention and learning. Solutions. Go ahead, Rachel, lead on.
Okay. Yes, I wholeheartedly agree with the video that the issue can be solved, but none of us can solve it alone. It's going to take all of us and more, along with strong changes in policies to make it happen. But some of the solutions that we're working on here, I'll touch on. So Robin mentioned about this issue of paying by attendance and not on enrollment. And the reason that's so important is that when when Juanita has a class of 6 toddlers, right? And one toddler is absent for a week because he's sick, her costs have not changed, right? Same teachers in the classroom, everything's the same, yet she's getting paid 1 child less. And so in our efforts to support, in our efforts to support with financial incentives, we're incentivizing quality by layering tier payments on top of the subsidy rate for programs. The state of Florida is also offering tier payments, but the Children's Trust is layering our payments on top of the state's payments to offer higher payments. We're paying our tier payment for all children, not just for subsidized children, and we're paying based on enrollment. So we simply collect enrollment from the schools every month. Juanita knows, she goes into the system, very easy, enters how many children by care level, and then they're paid this subsidy on top. So we want the money is going directly to the owners so that they can decide based on their budget where they need the money. Is it to increase teacher salaries? Is it for bonuses? Is it for capital improvements? Whatever it is. And then our next is the Thrive by 5 scholarships, which is going to what Robin was mentioning about women in the workforce. So these, I'm gonna have to move. These are women who are in the workforce. They may not be eligible. I'm sorry. They may not be eligible for this salary supplement program. So they need to, they don't qualify anymore for the subsidy. Give me one.
The only thing I don't like about the dog barking is that the 3 dogs that are here might hear and may join the chorus.
Sorry.
We're all
I'm
dog
so
and
sorry.
kid lovers, so don't worry.
I'm so sorry. So yeah, so they don't qualify for the school readiness subsidy. And so what the Children's Trust is doing in partnership with the Early Learning Coalition is we're offering a scholarship for exactly those families that Robin's speaking about. So this is families that have the opportunity to improve their economic mobility. We're trying to lift families out of generational poverty, get families back to work. I receive phone calls every day from families that are right in that spot of no longer qualifying for the childcare subsidy, but not making enough to be able to afford the high cost of quality care. We have, I believe, Avilio, over 900 children participating. I checked this morning, we have 902 children on the wait list and growing by the day. So this is an issue, as Robin mentioned, when families aren't able to achieve childcare, basically, typically the woman, right, gives up the career and stays home with the child. So we're really proud of that solution. Of course, you know, we have 902 families still waiting on the wait list. Some have multiple children, so we're really trying to work on that. And then lastly, to Avilio's point about closing the wage, or someone's point, I think it was Avilio, about closing the wage gap for early educators, is that we offer 2 programs for our teachers, because of course this is all about the children, but we need to support the workforce and the economic mobility of the early learning workforce. So we offer a scholarship program because we also want to recognize that our teachers should continue to engage in professional development, continue to engage in the latest, you know, research and coursework and all of that, just like the public school teachers are required to engage in ongoing professional development. But we offer scholarships and we pay for that professional development. We pay for document translation because a large majority in Miami-Dade County of our educators are immigrating from other countries. So we want to reduce the barriers for them to go back to college or engage in whatever professional development they need. And then we also support a salary supplement program. Definitely not at the point where we're closing the wage gap around pay parity between early learning educators and K through 12 educators. And definitely, unfortunately, we don't have enough money to bring everyone to a living wage, but we do offer a salary supplement program for teachers that rewards retention. So retaining teachers in your program, because continuity of care and having teachers remain is a marker of high quality. So we want teachers to remain, but we also want to encourage teachers to continue their professional development. So we support that salary supplement program, which we send checks out to teachers every 6 months. And so the Children's Trust sends $1.9 million a year directly into the pockets of our early learning educators. And that's for family childcare homes as well as childcare centers. So at this point, I would say that my call to action, I would agree with the video. I think the moment is here and now. And I think that, I think an awareness campaign, I think that gathering our community, which includes our business partners, which includes parents, which includes childcare owners, which includes elected officials, which includes all of the community-based organizations and all of us, we need to, pick the 2 or 3 issues. I think we know them all, and then focus together. And now's our time. We have, the light is shining on us. So I agree that it can be done, but we all need to focus our effort. And of course, everything we do at the Children's Trust, all of these supports are individualized. We really want to recognize that just like some children need more and some families need more, some childcare programs need more. So we're trying to lead with equity and just understand that this is not a one-size-fits-all solution.
Awareness campaigns, shining light. Our team is going crazy here. There's so many things that we can all do together. So thank you for that, Rachel. Juanita, the light is shining on you. And we need your leadership. Tell us what to do. What are some solutions?
Well, first of all, I would like to thank you all again, and especially those that have contributed. Like Rachel just said a moment ago, the Children's Trust have been wonderful as far as supporting us and bringing and sending the income that we truly need in order to continue what we're doing, as well as Evelio. Like I said, he's my #1 fan, or I'm his #1 fan. And I can go to him at any time to ask any questions and do what we have to do to make sure that we get the funding out. But for me and for most of our centers that we have out there, we need the funding. I mean, $15 an hour is just going to be a real challenge for most of us. And we seek to have and to get employees that are qualified and that want to be in that type of in that field. The centers ourselves, we must continue to strive to be the best that we possibly can be to provide a quality service, as most of us have been doing, so that people can recognize us as early learning educators like they do with Dade County Public Schools and all. We got to step up our game, some of us as well, and just continue to do what we need to do in order to provide the community with a great service. I'm hoping and praying that what we're saying, this has been a great meeting that will get to all the powers that be, that we're here, we're willing to provide a great service. We are providing a great service. We want them to come out and get our opinion too. Come out and do some of the community meetings, set community meetings up so that we can tell them and let them know what the needs are. So, ELC, the Children's Trust, been great with us, but I think we need a little help. So if they would come out and do what they need to do to help us get where we want to be, I think that we'll be okay and we can continue to provide a great service. That's it.
I'm going to break into a little bit of applause there. I don't know. I'm fired up. Robin.
Okay, so to reframe, the $15 an hour is your challenge, because all of these costs will get passed down to the parents. And what is occurring in the best schools in the low to moderate income communities is they are shrinking their size of seats for childcare, and they're moving into elementary school. So the parents will be paying more, and there will be seats that will not be available for low to moderate income families, because they're going to get changed for kindergarten and elementary school. When they do that, they get the federal funds. They get the funding based on attendance, on enrollment, not attendance, and it stabilizes their business model. Secondly, what is occurring now is a lot of money is coming down into the state. However, decisions are being made by elected officials, legislators, really without a strong seat at the table for the business owners. And mostly the legislators look at childcare from the practitioner side. They determine a set of benchmark and standards from the educational and care perspective. We are trying to change the conversation as economic development workforce, and these are small businesses, which is a very big issue for both Democrats and Republicans, small business. And until the conversation begins with childcare as a small business, then the state is really not going to deploy these new federal dollars as in a way that's allocated to so that the business owner can really maximize the resource to restructure their business model to move forward into the future. The third point is that each of you as a voter plays an integral role in this. It's between you and your legislators, if this is an important issue, to say, do you really understand this issue? And if they don't, then get them to understand how important this is for women in the workforce.
Fantastic. Evelio.
So, I think we have a long list of policy ideas, but let me just go over one, which I think is long overdue and is one of the most critical policy issues that we have in the state of Florida. It impacts low and moderate income communities, and it impacts rural counties in Florida. So this is not a South Florida issue. It is a statewide issue. And that is the reimbursement rates for the school readiness program. And like I said, it's a bit complicated, but let me just summarize it. Rates are based on the market rate in that particular community. So if a program can only charge a parent based on the market rate, $20 a day for a toddler, right? And the Early Learning Coalition's approved rate is $30. We can only pay that program $20. Now that disproportionately impacts very low income communities, right? High need communities. So what we need is a structure that allows us to, or a policy that allows us to pay the same rate regardless of the market rate in the community. Michelle knows a lot about this because she has every spreadsheet that, known to man that she's created and formulated addressing this particular issue. But it's something that is it's a matter of fairness and equity. We are paying the programs in the low income areas less than the programs in the middle income areas. So the programs that may need, if we go back to that slide where the little kids were, looking over the fence, if we go back and look at it from an equity issue, this is just an institutional issue that we need to resolve. We can't point the finger at any one particular person or institution, but it's something that has happened over time, decades old. And we need to try to fix that, because if I am running an early learning program in a middle income area, and I would love to open another one, and I want to go into one of the high need areas, it's going to be impossible for me to do that if I follow Robin's advice and look at the numbers and try to create a viable business. Why would I do that if I know that I'm going to get paid less than if I were in a middle income area? So it makes no sense at all. It's something that we have to resolve. The children, the teachers, and the center owners in those communities deserve the same level of reimbursement or payment for the children in the subsidized school readiness program, which is our largest program, by the way, as other programs in other areas. It'll strengthen the labor force. We know that, and we need some stability there. We'll help with recruitment and retention, aside from what Rachel mentioned with the wage incentives, and also professional development, which is, by the way, the child-teacher interaction is one of the best indicators of how well the children are going to do, or child outcomes, right? It impacts child outcomes. So we need to make sure that we provide those professional development opportunities for the teachers. It helps to address this issue that everyone is so concerned about with the minimum wage increase. And like I said earlier, quality costs money. Quality is not free. So it helps owners and directors and people that are running these programs continue to invest in quality. A couple of other issues. We mentioned the, Juanita Walker mentioned the pay by attendance instead of pay by enrollment. Well, if you look at the way the school districts are reimbursed in the charter schools, based on FTEs, right? How many students they have in that classroom. Why? Because your fixed costs don't change because you have 3 kids that were sick today, right? You still have to pay the teachers, the lights still have to be on. So the costs remain the same. So as another policy issue, not today, because, and like I said, we need to focus on 1 or 2 and, figure out how we get it to the finish line and then focus on some of the others. But we do need to have a discussion in this state about reimbursing our childcare programs the same way that we reimburse charter schools and school districts. Like I said, we have depressed rates in many communities, and that is part of the reason why we need to look at the reimbursement rate structure. And then I think that owners, Juanita Walker, maybe I'm speaking to you here, but I think owners at some point need to run for office. They need to become a member of the legislature. We know that, we complain, well, the school districts and the charter schools, but if you look at the makeup of the legislature, you have a bunch of charter school people that are members of the legislature, right? But we need childcare owners that will also volunteer to serve as a member of the legislature. Why not run for office? And then we have somebody up there, or a few people up there, that can really advocate for these policies. And I assure you, we will probably get payment for enrollment instead of payment for attendance, which will help to equal the playing field and level the playing field. So I think those are some of the issues. But again, if we can address this issue alone, I think it'll make a really big difference. And then we can tackle some of the others. But really, really important. And Michelle probably has a lot to say about reimbursement rates, because she is the state expert on, probably a national expert on reimbursement rates. And she's also looked at reimbursement rates in other states. And this is not a Florida issue, by the way. This is a nationwide issue that we need to address. But again, we have money right now, so we can address it. It's not recurring. They're not recurring dollars, but I think we need to address it and then maybe deal with how we fund it a little bit later.
Well, we're asking Michelle to join us now for the Q&A. Juanita for president is one thing that I heard clearly. Juanita for president, yes.
Yeah,
And as we go on and launch our next poll, I'm going to put out a request to the staff that affects all of us here. Sometimes after the impact collaboratives, we've gathered the expertise and recommendations that have come powerfully from our panelists, and it's been very clear that today is that day. You've been saying, several of you, that there are 2 or 3 focus issues of a list of 10 or more, and I'm going to ask Carolina to follow up with you all and see if we can get some consensus on what those are. And we'll ask you to identify, when we do, who affects those. We have the co-chairs of our advocacy committee here, many of our members of the board. Are those federal policies that affect the market rates? Who can change that? If Juanita becomes president, what does she have to become the president of to change the institutional decades old issue? So, where do we need to go? And maybe some of that will come up in the Q&A questions that we have now. But in any case, I think we'd like to have some recommendations from this panel and keynote to share. I'm going to go ahead and ask the first question, and give it some leverage. So the first question comes from the co-chair of the grant making committee, who's also a board member, Michelle Austin Pammies. But for you all to know, she's also one of the co-founders of the Women of Color Empowerment Institute. That means that the information that we gather here gets leveraged in other places, because everybody's coming here, you know, together with women, some in the context of your women's fund, but we all have other connections. So we encourage everybody to utilize and leverage these connections as we come forward with the recommendations. The question that Michelle asks is, do you believe there's a gap in knowledge about the child care tax credit that's coming through now, huge, and other child care funds that will be available? Robin already answered yes, but can you answer, panel, even more concretely, what do we have to do? What kind of public awareness campaigns are necessary for people to leverage it? And if one of you can take on the task of summarizing the child care credit, is that you, Michelle, who's nodding? Do you want to do that for us?
Sure.
Go ahead.
Absolutely. So beginning this month, families, depending on their earnings and the age of their children, could be eligible up to $300 per month per child for the next at least 12 months as part of the American Rescue Plan. So the conversations that we're hearing is that, you know, if you filed your 2020 taxes, that money will be automatically deposited into your account at the rate of $300 per month. Let's say if you are a single mom with 2 children under 5, that's $600 per month. And so many times what I've heard as I've gone around the state and talked about childcare finance and what that means, I keep hearing a lot about, well, families are about to get $600 to offset that cost. And I think that that is a really short-sighted approach. One of the things that we have not done well in Florida is through any of our public benefits programs is actually capture what a family's expenses really are. Anytime you qualify for any public benefit, it's what is your income, and income only, not necessarily what are your expenses. So what we don't know is, you know, for jobs, we know that holistically around the state, we have more job openings than we have unemployed. In an effort that breeds demand. And when that breeds demand, that breeds increased salaries, right? Or increased wages. We also know that $11 an hour, usually for a family based on size, removes them from being eligible for Medicaid. So they move into Florida Kid Care. And so some of those dollars are going to be having to offset their co-payment now and their monthly bill against what it takes to keep their child in kid care so that they have health coverage. So there's a lot of competing priorities for this child care tax credit. And I want us all to take a moment and not assume that it can just be used to overlay for childcare and be a seamless integration. It will be used to offset other costs that are needed to care for children. And we as a state don't know what that really specifically is. We can make some, we can do some models, but because we don't actually capture a family's budget or expenses, that is really unknown. So I don't think we should wholly assume that that can actually go straight to childcare moving forward.
So two requests. One, we're going to ask in that follow-up for you to help us to get a clear messaging that we can share with people on what they have to do to apply for that credit, because that's a service that we can give to our community. And the second one, I know we've spoken about this with our board chair and other members of the board. And I don't know, Michelle, I'm sorry to come back to you again, or somebody else can jump in, but who is watching this plan of monies coming down? Debbie Bussell, who's here with us today, I know has identified other states that are already saying what the plans are for these federal monies coming through. Where is that plan in Florida? Who's monitoring it, and how can we help you to defend us?
So can
Absolutely.
I for a second? Oh, Michelle, just one. So I'm working closely with Lois Frankel's office, and she's the co-chair of the Women's Democratic Caucus. Their number one issue is childcare. They are very concerned about those funds going to the families that are off the grid. So families that are in the workforce that have filed taxes, they will get that money. It's the families that are outside of that. And so if you or anyone in this call can be of help as to how the information flows to these families, that would be very important.
I meant to unmute. People are listening. People are listening, and we'll look to all of your expertise and to share that. And for the big picture plan, to see, because we want to rebuild better, right? Everybody here is saying the child care, and not just to call it child care today, to oversimplify, right? The system wasn't great before. Now there is funding coming through. How do we bridge to something that's better, a new construction, not just putting bricks back into an old bridge? When will we see that plan of what happens to the new monies?
So the Florida Office of Early Learning is responsible for the child care plan, which includes $1.5 billion for stabilization. So those are grants that are to be given to providers to stabilize the infrastructure of their childcare or early learning setting moving forward. Those grants are available until 2023, September 30th, 2023 to be exact. And that is actually supposed to be outlined in Florida's Child Care and Development Fund plan that is supposed to go to the feds today. As of the last iteration of the plan, that question was not answered in the Child Care and Development Fund plan. So I hate to say that we don't know, but we don't necessarily know how the $1.5 billion is going to be spent. I do say that all of the guidance that has been given to the federal government, not only around the stabilization dollars, but also around the increased Child Care and Development Fund dollars, has been spot on for what actually really needs to happen in Florida. One of the things and that Florida can do is not look at those dollars as discrete funding streams, but how do you integrate those dollars to work together and really complement a true rebuilding of the infrastructure that makes sense. So there's definitely some short-term opportunities with these dollars that will lead to long-term outcomes. One, we already talked about the need for workforce today. The state has the ability to define essential workers within its Child Care and Development Fund plan, not necessarily by governor's executive order this time. And so if we make child care instructors and educators the essential workers, then that is an opportunity to potentially garner a larger employee pool for those families that have young children that would then be able to access childcare as part of being an early childhood instructor. The other thing that I think we could really look at doing well in Florida is, for so long, we really concentrate on the per child cost. How much does it cost? And I think we've heard that, the classroom doesn't change, is that if we could really look at these stabilization grants at the classroom level, what does it cost to operate your classroom, and really think about how we stabilize that, I think would help move forward as it relates to being able to pay appropriate wages. The other is that the feds have said, please undertake a true cost of care exercise. Go to your communities, hold town halls, ask providers, look at their budgets if they're willing to share, and say, what does it actually really cost to provide high quality care? And please pay above their private pay rate if you need to, if that really is what is going to make a difference in access and equity. So really making sure that we've done that instead of looking at market rates. One of the things that was passed as part of House Bill 419 was the ability for the Office of Early Learning to submit an alternative methodology to collection of market rates. From a finance standpoint, I feel that's really important over the next 5 years with the minimum wage increases, because that is a look back. And by the time that market rate is published, it will be out of date, because there will be another stepped increase in those wages. And so there's real opportunities to move forward. I also think that looking at contracted slots to make sure that we are ensuring that providers that are offering high quality atmospheres for children have the number of enrollments they need to be successful to stabilize cash flow. Across the nation, a provider has to be at almost 80% desired enrollment to be able to really maintain all high quality services. Within that perspective, with 60 to 80% of their budget being utilized for staff pay. And so if that cost is increasing, they have to right size their budget, and that ends up being in the curriculum components, in the materials component, right? Because they have to move forward with a sustainable business. The other is that we need to really make sure that childcare providers are recognized as small businesses, Robin said, and that they really determine the compensation packages for their employees. You might have an employee that needs to offer $13 an hour, but healthcare is really important to her staff or his staff, because what it doesn't do is it doesn't knock them out of eligibility for housing or subsidized childcare. And so that's that sweet spot to ensure that overall that childcare instructors don't lose other public benefits. Whereas you might have another teacher who needs $15 an hour because they have the other resources necessary to be successful. So I think that making sure that we are really giving due diligence to making sure that businesses can determine payment packages for their employees, even at an employee by employee basis, is really important to making sure that we've got long-term infrastructure moving forward.
Fantastic. In the couple of minutes we have left, Leslie Sternley has a quality of care question. Juanita, I don't know if this is for you or who would like to take it. Given that it's so difficult to staff a childcare facility, how are the childcare workers being trained to be educators using a particular skill set rather than just rather than babysitters? Staff turnover is a challenge as well, right?
So I can take part of that question, and Juanita can chime in. So we have a professional development institute through the Early Learning Coalition. So there's a lot of professional development opportunities for the staff that are working in the programs free of charge. We work very closely with the colleges and universities, FIU, in particular with Miami-Dade College, to try to make sure that those opportunities are there. There are opportunities for national childcare credentials. There are opportunities for obtaining an associate degree. And so we try to encourage the staff to participate in all of the, aside from the minimum requirement, which is almost, I hate to say it, but it's almost nothing. There's a minimum requirement, but most programs want to go above and beyond. It becomes a little bit difficult because they can be in the classroom working with children in a professional development, Zoom or in a classroom somewhere else, right? So it's very difficult. And there's an expectation from the staff that if they are going to participate in professional development as part of their work, right, like in any other organization, that they're going to be compensated for that time. So it does become a little bit challenging, but we do provide a lot of opportunities for the staff to obtain advanced credentials. Now, what happens is usually, and you heard this before, when a teacher earns a bachelor's degree, they jump over to the school district, right? Better benefits and better pay, which is a great thing for the school district and for the community, but not so much for the childcare program that lost a great qualified teacher that now has a bachelor's degree. So that becomes one of our bigger challenges. Now, of course, if we're being compensated and have benefits at least equal to what they can receive at in the school district, then it wouldn't be as much of a problem. But that's a reality of the situation. But we do offer a bunch of professional development opportunities. Yeah, we want to make sure that babysitting is no longer part of what anyone thinks of when they think of early learning or early learning programs.
As
And
Juanita takes it home for us in the last seconds that we have, Vivi, go ahead and show our next slides that can ask people to do what we want them to do in the slides, because I'd rather hear Juanita speak. So take it home for us, Juanita.
You know, I totally agree. And with what Evelio had said, professional development is so important. And me as an owner, I make sure that we get all the training that we could possibly get. And what's an incentive is taking these training that they're being paid, because most of the trainings, or quite a few of the trainings, are on weekends. So we want to make sure that our staff are getting paid, and they're receiving what they're supposed to be receiving in order to do that. At this particular point, I do whatever I have to do. If there's a staff member with a bachelor's or other degrees, I'm going to pay them as much as I possibly can just to try and hold on to them. And communicate. So that's it for me.
You are all amazing communicators, and we are so lucky to have your leadership. And I know everybody here, this has been such a rich chat and a lot of people taking notes. This does not end here. This is your Women's Fund, Miami-Dade, and we respect your time. So happy 4th of July weekend to everybody. And we'll see you the first Thursday of each month right here. We're all connected. Thank you all. Panel, keynote, thank you. And thank you for agreeing to stay in touch these upcoming weeks.
Absolutely. Thank you for having me.
Thank you.
Yeah, thank you for your help.
Yes, thank you so much. I
Please,
want to be
thank
more
you.
involved too.
You are, if careful, you're
Careful
done.
what I asked for, right?
Juanita, we should, we'll set up another time to talk about all the different ways and what fits you, where there's resonance.
Okay.
Is because you're busy. So we've got all kinds of things we could just, love. I mean, as I say, this isn't us and them. It's your Women's Fund. I mean, we're a handful of staff and, 20 Breaking Sweat board members, and a lot of people are volunteering to be on our committees. I mean, this is us.
I'm volunteering to serve as Juanita's campaign manager, and Robin Perman will be her treasurer.
Running for president.
I'll be the treasurer. There you go. But it's governor, by the way.
Governor Juanita. Okay, right.
Because the money runs the state legislature. They're making the decisions.
I think that's a great idea, Robin.
Juanita, seriously, you should consider running for at least the state legislature. I mean, with your background, it should not be all that difficult to get you elected. So you should really consider that at some point.
Whoa.
I hear you. I hear you.
I don't know. Listen, you've got the Don, so that's okay. We'll cover our backs. All right.
Juanita, we're not allowed to be political in the Women's Fund, but on a personal level, you've totally got my vote.
Oh, right. And Ruby White just responded, she'll be my assistant. Right, Ruby?
There you go.
Oh, all right.
Thank you all so much.
The gratitude.
Every time we're with the Robin, we've got some crazy idea. We better get off now.
Take care. I'm calling you.
Thank you all. Have a nice trip, Juanita. Thank you for putting it off for us. Team, I love you. Rachel, thanks for masterminding.
Sorry about the dog.
Excuse me, I've got 3 out there. It was no.
He only barks when I'm like in an important Zoom call. Otherwise, he's quiet the whole day.
They're very intuitive, right?
All right, take care.
Thank you.